The Quotient system is an FDA-cleared device for the objective measurement of hyperactivity, impulsivity, and inattention as an aid in the assessment of ADHD.
Medical professionals like Dr. Sandeep Vaishnavi are happy to have the right tools to help those who need it most.
So it's that balance between overdiagnosis and underdiagnosis. And I think the more tools we have, like Quotient, the more likely it is that we're able to find that right balance. It's useful to have for me as a physician because I can integrate data that I get from Quotient along with the neurological exam, the mental status exam, rating scales, all these other things, and put it together and come up with the best diagnosis.
The Quotient system measures the three components of ADHD: the motor overactivity, inattentiveness, and impulsivity. It measures a person's response to a simple concentration task, while at the same time recording their head and, for 13-year-olds and older, also their leg movements.
This test is said to be 90% accurate and is complemented by a clinical evaluation. Alex has been on medication to treat ADHD since taking the original test.
After about a month of being on medication, Dr. Wishick has you come in again and you do a second round of the testing, and then you get a comparison result. And I was blown away by the improvement that I saw.
A third test.
Today's score for movement shows no excessive movement.
And that was reflected in daily life as well.
That's a pretty typical reaction. A lot of people find the diagnosis a little nebulous. So to show them something that matches up with their daily complaints is a big deal.
When I came and visited the classroom, I felt like that wasn't the best of what he had to offer.
For them, the clinical interview seems like, well, we're just talking. How do you make a diagnosis from talking?
So now a new computerized test called Quotient can objectively measure the core symptoms of ADHD.
It's an additional tool that allows me to look at where this person falls on a spectrum of inattention, impulsivity.
Dr. Cerulli got the results from the Quotient website and printed out a report for Owen's mom. He was then diagnosed with ADHD.
It was a huge relief, actually, because you can see it on the paper and you can say, okay, yes, I do see that.
And with treatment, Owen rose to the top of his class.
I finally feel like he is where he should be.
Sometimes I think I just space out, but that's mostly like in the classes that are harder for me.
It's a chemical regulation. You can see their frontal lobe activity not being there full-fledged, and so they cannot regulate their body.
With ADHD, everything can be so subjective, and it's nice now to have this objective test.
Doctors say the new test is not only helpful in diagnosing ADHD, but monitoring patients who take medication to treat the condition.
There is no cure for it, but it is treatable. So when you are able to correct a condition, it's worth improving their quality of life.
Jillian has been on medication for ADHD since she was in 2nd grade, and she is a student that really can't function without it. But every once in a while we hit a wall, so this is a great way now to tell whether is it time to adjust her medication.
Well, I think the difficulty is that so much of it is subjective. We rely a lot on parent report, child report, teacher reports, and sometimes that can be very, very difficult. There are often other problems besides attentional problems that impact on the evaluation of attention. Well, the Quotient system measures motion. It measures errors of omission, commission, latency of response, and variability of response. And here is a good example of how this information is so nicely graphically demonstrated. This is a transition from no medicine to optimal medication, with the markers showing less motion as time goes on, and most importantly, the green shows 30-second increments of information that are virtually not present on no medicine and virtually present completely on the optimal dosage of medicine.
I just thought it was Charles, that I could correct it. But when they told me that he could not help it, running into a wall or running into somebody, then I knew that we had a problem.
In the past, diagnosing ADHD was challenging because doctors had to rely on parent and teacher observations. Now there's a more objective tool. The quotient system, which originated at Harvard Medical School, measures motion and attention to give hard data on core symptoms.
The quotient system gives us a very digestible way to give parents a graphing of their child's symptoms, strengths and weaknesses, looking at focus, concentration, fidgetiness, restlessness, motion, overall, in order to help them really understand where treatment can be helpful for their particular child's symptoms. Is that self-esteem can go down very quickly and mood struggles can go up. So we really want to be accurate in diagnosing.
When he got on the medicine, everything went normal, and he's doing very well in school now.
I appreciate more objective feedback with the test because right now the ADHD diagnosis is so subjective.
The test is not just for children. Adults can be evaluated this way too, and Tomasovic says it will be useful in deciding on medications to manage the condition.
This can help with titrating, so it's more aggressive management with titrating the dosage. Always being sensitive to side effects, because you always have to respect
and his parents took steps to ensure a brighter future for their family. It all started with the Quotient ADHD system.
He used to fight us really bad to do homework, and now he'll actually do his homework. So it's a huge difference.
A simple 15-minute screening is all it took. The Quotient system is the first test to receive FDA approval for diagnosing and treating ADHD.
Adding the Quotient test to my evaluation of a child who's not doing well in school, who might have ADHD, has improved my precision in identifying those who do, those who don't, and even those who do that are under treatment that need further adjustment of their treatment plan.
In Cameron's case, doctors worked for a year trying to find the right medication. The test helped Dr. Jaffe discover which meds work best for Cameron.
He went from being not able to sit still and pay attention in class to teachers marveling at, wow, he's actually doing the work, he's listening, he's gaining knowledge.
Fraser says her son has more confidence and she's amazed at his progress. She also has a message for other mothers who are at their wits' end.
If you think there's any kind of a problem, don't delay. It doesn't go away, it only gets worse. Needs to be treated, very non-invasive testing, very quick. I think it took Cameron about 15 minutes to do, and gave us lots of lots of answers.
It helps make the diagnosis. It helps determine when I choose a medication, how well that medication is working.
For Lindsay, an ADHD diagnosis and medication have made a big difference in her life, academically and socially.
Even just when we're kind of hanging out, I'm kind of able to stay on the topics that they're talking about, because sometimes I would just kind of zone out and then I'd be like, no, wait, what are you talking about?
She now has her sights set on good grades and cosmetology school.
So now I can kind of live up to what I know I can be.